everyone. Top of the hour, and it's time for Lightning Talk 1 session. I am head of Maps and Geospatial Services and the Social Sciences Coordinator at Michigan State University Libraries, which is, of course, one of our member institutions in the BTAA Geospatial Information Network. Our slide runner for this session is Sue Oldenburg, GIS Specialist at Rutgers University. I will be introducing each speaker before their presentation, and the Q&A portion will be at the end of the 4 lightning round presentations. But you can, if you think of a question, go ahead and type it into the Q&A, and you can also upvote other people's questions if you like, and I'll get to them after the 4th presenter. The speakers can use the chat function for technical problems, and that will just go to the host and the panelists. So let's go ahead and get started. Our first presenter is Tåsi Jones. Tåsi is a Tomorrow Masters of Public Health student at the University of Washington. Her prior work includes community-based participatory research and needs assessments related to public transit and non-emergency medical transportation. She is broadly interested in community-driven interventions and how mobility systems shape health equity for Indigenous communities. Please go ahead.
Afide. Hello, y'all. Thank you for having me. This is an ongoing project looking at how spatial access to primary care changes when we disaggregate two commonly combined communities. Next slide, please. So the AAPI umbrella is the Asian American Pacific Islander umbrella that is a common analysis and reporting unit that combines one of the largest populations in the world, Asians, with one of the smallest ones, Native Hawaiians and Pacific Islanders. And while it's useful for reporting with small sample sizes, it also really heavily limits our visibility. And as a result, when you disaggregate this information, Native Hawaiian and Pacific Islanders tend to have significantly different socioeconomic outcomes. In particular, we have a much higher chronic disease burden. Now, two of the biggest barriers to improving chronic disease health outcomes include transportation and cost. And in particular, when you're looking at transportation, travel time to care is heavily predictive of appointment no-shows, which is why it's the focus of this work. I selected Texas as a setting, not only because it's my own community, but also it has the 3rd largest population in the US. And it also tends to be underrepresented in NHPI-focused studies. In particular, Houston is in the top 5 most segregated metropolitan areas in the country, and they are increasing a lot of investment into the transit system, but the infrastructure still tends to be heavily susceptible to extreme weather events. Next slide, please. While I was looking at current spatial access methods, a lot of approaches are incorporating like multimodal approaches that are well suited to urban areas just because you have a bit more advanced transit system. But these also tend to have a lot of reliance on data or software that is proprietary or locked behind pretty expensive barriers, which is one of the things I really wanted to consider when working on this was the accessibility and barrier to entry. Next slide, please. Combined together, this led to the research question of how spatial access to healthcare facilities and transportation resources differ between the two communities in Houston. And some of the key aims that go into this is using neighborhoods as a proxy in lieu of areas where we really don't have any information on Native Hawaiian Pacific Islander economic and medical outcomes. So identifying the top neighborhood characteristics, also calculating general primary care facility accessibility scores. And because Texas has 2 times the national average in terms of uninsured rates, looking at access to sites that provide free and reduced care. And then the third aim is to create a reproducible workflow that can be used for small populations in urban areas. Next slide, please. So the methods really relying a lot on government data sets and everything from the cleaning to the geocoding to analysis occurs in R. I'm using an API for the census and then Houston Metro data. Everything else is manually downloaded. But the idea is to take the origin locations of these census tracts, the locations of these primary care sites, and then the transit network to create a travel time matrices in R using the R5R package. This is combined with transportation preferences, and then I'm using a multimodal enhanced two-step floating catchment area, very long, method to create weighted tract accessibility scores. And then these scores are going to be mapped to help kind of like visibly illustrate the community characteristics and what that access looks like. I think that that is a little bit nicer communication tool than 5,000 rows in a table. Next slide, please. So this is ongoing, but preliminary descriptive results. I was really interested in working household vehicle ownership, working vehicle ownership, just because that really reifies the importance of the local transit system and also the percent of residents per tract living in poverty, as that tends to correlate pretty strongly with disease outcomes and insurance rates. As you can see, the actually top NHPI census tract by proportion has almost 49% of the residents living in a household without a working vehicle. And in figure two, it's interesting, both NHPI census tracts and the Asian census tracts have 60% living in what is like federally designated high poverty area. But the remaining 40% of Asian census tracts are in areas that are of not any kind of like economic concern. So they're a little bit more middle to upper middle working class, whereas the remaining 40% of NHPI tracts are in areas of suspected high poverty, which means that it looks like a significant portion of the area is below the poverty line, but there isn't quite the statistical significance given to assert that for sure. Really driving home how important it is to disaggregate and also capture these differences. Next slide, please. So this is very quick, but some of the benefits of this approach is that it incorporates modal resiliency. If my car breaks down or your bus is running late, how easily can you still reach your appointment? It is also open source and reproducible, which makes the barrier for use quite low. And it also captures a lot of these intersecting structural vulnerabilities, whether it's disease burden or access to care that you can actually afford. And in addition, the main focus is on the margins of the margins. So disaggregating a lot of these commonly aggregated populations and addressing a big empirical gap, which is NHPI spatial access to care. That being said, spatial access is not the same as utilization, and the next steps for this is to add in metrics that capture quality, affordability, and acceptability of care. One of my ways around the lack of data specifically on my community is to use neighborhood characteristics, which as a proxy, so assuming that people tend to live in areas that reflect their own circumstances. The drawback of that assumption is that it can often under or overstate some of the like economic and educational outcomes of communities, which is another thing to consider. That all being said, I think that really pushes the importance of disaggregating data and collecting this data in the first place.
One minute.
Thank you. I think also being from the area, Houston, Texas has a very strong Pacific Islander community that is very interested in community organizing. And so tools like this can be used to develop targeted outreach, mobile care initiatives, and in general, really just render what is a largely invisible population more visible. Next slide, please. Sainamasi, thank you. And my next slide has all of my references. Thank you again.
Thank you very much. I see that was very interesting. Just a reminder, the Q&A will be handled at the end of the four presentations, but go ahead and type one in if you like. Now, let me introduce our next speaker, Sasha Riesig. Sasha is a graduate student in the Masters of Geographic Information Science program at the University of Minnesota. With internship experiences in law enforcement, Sasha is interested in using GIS as a tool to support intelligence and crime analysis for law enforcement. His research interests include crime mapping, remote sensing, and cartography. Please go ahead, Sasha, and begin your presentation.
Unmuted. Hello, everyone. My name is Sasha Riesig. Today, I'll be presenting analysis of crime counts in Washington, D.C., 100 days before and during the National Guard mobilization. So I did this project for my Principles of Geospatial Computing course last fall. We're kind of learning about Python and how to use GIS integration for visualization. Next slide, please. So on August 8th, 2025, in Washington, D.C., President Trump announces that there will be a National Guard mobilization to, quote, rescue our nation's capital from crime, bloodshed, bedlam, and squalor, and worse. Globally, Washington, D.C. has pretty high violent crime rates, and recent violent attacks in months prior kind of triggered the decision to mobilize the National Guard. During that National Guard mobilization, President Trump quotes that carjackings are down 83%, robberies are down 46%, car thefts are down 21%, and overall violent crime is down 22%. This project seeks to analyze how crime counts have changed since mobilization, again, using Python and GIS to kind of visualize this. Next slide, please. For methodology, I used a Jupyter notebook with Python code, first to analyze DC crime data for 2025. Since it was the fall, I went until November 26th, 2025, and then DC census tracts for 2020. And with the crime data, this includes the offense, the nature of the location, and the census tract. So I filtered the crimes by time range of 100 days. So for pre-National Guard mobilization, from April 30th to August 10th, 2025, and for the National Guard mobilization, August 11th to November 16th. I then did some visualizations with this, first to count the crimes by day for the time periods, then to count the crimes by the offense for the time periods, and then to count the crimes by the census tract for the period, thus calculating the percentage change as well to see how crime counts have shifted before and during the National Guard mobilization. Next slide, please. So first, to analyze the daily crime counts in Washington, D.C., we see that crime counts fluctuate over time. There are a lot of high points for the number of crimes per day in the first 100 days prior to the National Guard mobilization, and then we do see a shift in decreasing during the mobilization. There's still some high points, but they are not as high compared to prior to the mobilization of the National Guard. Next slide, please. Next, to look at crime counts by offense, I found that there was a decrease in the offense counts during the mobilization, primarily within the theft category of crimes, such as motor vehicle thefts, auto theft, robbery, and then the other types of theft. There were other offense types that saw little change, such as assault with a dangerous weapon or burglary. So again, there wasn't much change there, but with the thefts, there are decreases in those crime counts during the mobilization. Next slide, please. Further, to look at the census tracts, crime counts, many census tracts have a low count of crime prior to the mobilization of the National Guard. So in this map, they are kind of this lower purple-blue hue, but I did find that some census tracts such as 005802, 004401, and 008803 did have higher crime counts 100 days prior to the mobilization. So in the map, there are the green and the yellow colored census tracts. And I'll also add that I chose census tracts as that was the data that was available. It seems that there's no neighborhood boundary in Washington, D.C. It's all kind of fuzzy or grouped together, as I spoke to someone in my class regarding about Washington, D.C. neighborhoods. Next slide, please. So then looking at the first 100 days of National Guard mobilization, the crime counts did seem to lower but those that had lower crime counts prior to the mobilization still had a similar low crime count during the mobilization. And then I did find that there were some census tracts that did see a decrease if they were higher prior to the mobilization. But some of these numbers are still very similar to prior to the mobilization. Next slide, please. So lastly, I conducted a percentage change of the crime counts. Many census tracts did see a decrease in the percentage change of crime counts before and during the mobilization. However, there's an extreme outlier of 600%, which is census tract 000803, which is the bright red census tract on the map. Other census tracts did see an increase in crime counts. However, this might be attributed to very small crime counts initially. I know some census tracts had one or two crimes occurring prior to the National Guard mobilization, and then during the mobilization, they did see an increase of maybe 3 to 5 crimes occurring. Next slide, please. So to just wrap it up, I analyzed crime count changes since the National Guard mobilization within the first 100 days, primarily using Python and GIS to visualize this. My results suggest that crime counts fluctuate and were lowered during the National Guard mobilization. Also, that theft-related crimes decreased greatly, while other crime categories decreased less. And then lastly, most census tracts experienced a decrease in crimes after 100 days of mobilization. That's all that I have, and thank you so much for attending.
There we go. Thank you very much. Yes, neighborhood boundaries, that's a thing. So go ahead and type in a question if you wish. We'll handle them later. We're going to move right on to our third presentation. I'll introduce our next speaker, who's Gabi Skinner. Gabi is a Master of Social Work student at the University of Michigan and a research coordinator with the Department of Psychiatry. Her interests are driven by a commitment to mental health care equity and the use of program evaluation to bridge systemic gaps. Generally, she enjoys exploring how data-driven insights can improve clinical outcomes for individuals living with serious mental illness. Please go ahead, Gabi, and begin your presentation.
Great, thank you so much. So like introduced, I'm going to kind of be looking at mapping mental health. So how redlining that practice kind of echoes in Wayne County specifically, which encompasses Detroit. So before I move on to a couple of the new slides, I guess I should say next slide, please. Okay, so on the right here, we see a map. And just as a brief kind of context, in 1939, federal appraisers drew maps that essentially decided which Detroit neighborhoods would receive mortgage investment and which would not. So who's going to get approved for loans and who's not. And these same boundaries, I was kind of interested in seeing, okay, how are mental health outcomes in these areas, and are they any different from areas that are not encompassed in the redlining? And if we could go ahead and move to the next slide. So I want to kind of preface with that 1939 HOLC map, we kind of categorized a couple of things. So there was green being best, red being hazardous, and these were commonly kind of labeled as A, B, C, D. The basis of this was mostly due to racial composition of these neighborhoods at the time. So this isn't informal bias. It's a federally institutionalized mechanism of separating people. And the pathway that I looked at was, okay, we have denied homeownership. That kind of leads to suppressed wealth accumulation. This can over time lead to a concentrated poverty. And then we see a degraded infrastructure. And the outcome of that ultimately that I wanted to look at was, what is the mental health burden of folks who are still living in these areas? So none of these downstream effects really require anyone to actively discriminate after 1968. the damage is already done by these structural kind of things that were put in place. So Wayne County was the deliberate choice. It's one of the most segregated metro areas in the United States, and it has a lot of documentation through the Mapping Inequity Archive, which with those HLC maps as well. We basically, how I did this was I overlaid 627 modern census tracts with that original HOLC boundary polygons, and I used a area weighted GIS intersection, and that kind of gave each tract a continuous redlining index based on how much of its area actually fell within each grade. And from the demographics that we have here, it's pretty narrow. So that's one of my limitations, and that was just to cut for time. But we see a Hispanic concentration that shows the sharpest gradient, right? So we have 3% represented in grade A tracts, while 14% is in grade D. Grade D tracts are typically, 76 minority overall. And then we see Black residents are kind of distributed across all 4 grades, which actually speaks to the argument that financial exclusion was broad. It's not geographically contained to a single tier. And if we can move to the next slide. So we see here, I kind of looked at HMDA data with just one single time point. So that is one of my limitations. It's not longitudinal, but we do see from this single data point that Black applicants face a 45% denial rate countywide. White applicants have a 26%. So that's an 18-point gap, and it holds across every redlining quartile from low to severe. One thing that I want to point attention to is the rate spread. So even when approved, Black applicants pay more, and that rate spreads from 0.3 to 0.5 points above white applicants. So essentially, the penalty is kind of following these Black borrowers across the county, not just in the worst grades. One thing that I would like to also note, or I guess we can move to the next slide. Okay. One of the things that I wanted to kind of point to was I started looking at mapping redlining and then also the distribution of facility locations. So it was actually interesting with a paradox that I looked at. So severely redlined tracts are actually physically closer to mental health facilities on average. So 1.8 kilometers versus 2.7 kilometers in low redlining areas. And this is by looking at raw distance. So access looks better in the most redlined communities. But if we flip this, in those same tracts, 41% of residents live below 200% of the poverty line, 25% lack reliable transportation, and then 6.6% are uninsured. So this essentially speaks to, proximity means nothing if you can't afford a copay, if you can't take time off work, and if you have no way to get there. And we can go to the next slide, please. All right. So I essentially wanted to move on to mapping mental health burden. So I combined 3 CDC places measures, which was poor mental health days, depression prevalence, as well as lack of social support, into a composite burden score for each of those 627 tracts. So essentially 94.6 of the highest burden tracts physically overlap with historical HOLC boundaries. That area weighted HOLC score averages 2.41 in high burden tracts versus 1.19 in non-high burden tracts. So that's more than a full grade unit difference using the actual 1939 boundary geometry. One relevant regression result that I found. So a regression model explains 82% of variance in mental health burden access across 336 tracts. Transportation barriers are the strongest predictor, but kind of here's what matters. So the redlining index itself remains a significant positive independent predictor even after controlling for poverty, uninsurance income, suggesting that this historical mortgage discrimination kind of carries a structural footprint on mental health that current socioeconomic conditions alone cannot explain. And this effect may be smaller, I'm thinking, because in Detroit, we've seen a lot of gentrification, and that means folks are coming in, and it's not representative of maybe folks who have lived there historically. So that's something to consider for future project development as well. And if we can move on to the next slide. All right. So just kind of wrapping this up a little bit, the maps are gone, but the pathways that they've created from financial exclusion to
1 minute.
poverty to degraded infrastructure to limited mental health care, that's still ongoing. And the most actionable finding that I found was that transportation barriers are the strongest predictor of mental health in this model. So this is kind of a policy lever that we have to look at and see, okay, we're considered the motor city, so why is this an issue? And we really need to look at kind of the integration of mobile mental health units, telehealth expansions are kind of those higher burden tracks as well. I'm trying to see here. Oh, really quick, I have 20 seconds. But I want to shout out to one of my professors, Dr. Nari Yo, for kind of exposing that exploration through GIS methods is highly applicable and important in the field of social work. So thank you.
Thank you very much. That's great. Okay, we're going to move on to our fourth speaker, Austin Bartos, who's a GIS specialist at the Institute for Fisheries Research with the Michigan DNR and University of Michigan. He says, I use GIS on all things fish related in Michigan, including research, management, database curation, and application development. Thank you, Austin. Go take it away.
Thanks so much for that introduction, and good afternoon, everyone. As was mentioned, I'm with the Michigan DNR and the University of Michigan School for Environment and Sustainability, and today I'm going to be sharing with you all one of our new products.
Yeah, we can't hear you.
Can you hear me now?
Yes, good.
Oh, perfect. All right, sorry about that. So today I'm going to be sharing with you all one of our new products. It's an interactive web application depicting Michigan's trout and salmon fishing regulations. Next slide, please. Michigan regulates dozens of fish species across thousands of lakes and miles of river. Fishing is regulated through an array of parameters such as size limits for fish, tackle restrictions, and spawning closures. These regulations are essential for the conservation, protection, and management of fish populations within the state. Next slide, please. These regulations come from a series of legal orders. There's a handful there shown on the screen. They're large legal text documents that describe locations such as water bodies and lakes and rivers, as well as the various fish species. So for this application, it was trout species. And these documents describe, the details of those regulations. So like I mentioned, spawning closures, tackle restrictions, and size limits. And it's unreasonable to expect members of the public and anglers to, both read all of these documents and digest them and apply them to their own recreation. So every year the state puts together a Michigan Fishing Regulations book, shown there on the right. And this kind of combines all of the different legal orders into a digestible format. So it's organized by water bodies. So for example, if you're going to go fish on your local lake, you could find that in the book and then get some more detail on exactly what the regulations are for that water body and for the species that you might be targeting. Next page, please. As you can imagine, that information, even in this kind of this concise format, is still a lot to process, especially if you're fishing multiple waters, as well as not having a spatial component. These lakes and rivers are on the map, as you would say, and with just a text description in a pamphlet, it's not the most intuitive to understand exactly what the regulations are for the water that you might be fishing. And so about 15 years ago, our office, took that problem and started developing some static paper maps that you can see on the right there. And these very simply depict the various types of trout and salmon regulations. So for our rivers, we have 4 different types with their various colors kind of describing those. And for example, like blue or type 4 is going to have a more restrictive regulation on things like brown trout, where the type 1 is going to be less restrictive. So these paper maps were really only showing that surface level detail of basically what category that water body fell in. And so as you can imagine, that's really not the amount of detail that an angler would need to in order to kind of understand the regulation completely, because it's missing that information such as size limits and like spawning closures and that sort of thing, because it's only a visual medium. Next slide, please. To remedy that situation, this past year or so, we've been putting together an enhanced GIS database with this regulation information for trout and salmon. This expands the previous kind of database from just only having those categorical type data to having the very specific regulation information from those legal orders. So this includes, the fishing seasons, possession seasons, year restrictions, all the size limits for the various trout and salmon species, and even more than that. And so to develop this, we used a combination of Python scripts as well as just manual data entry for some of the more complex regulations in order to populate this database. And this spans all of the waters in the state of Michigan. So this is a very robust database with over 100,000 records. Next slide, please. In order to make this database usable for both the public and for our own staff, we transitioned from these static paper maps into an accessible ArcGIS Experience Builder application. So this kind of mimics that format that anglers have been used to for the past 15 years into an interactive web map. So this is just a screenshot on the right, but as an example, one of the lakes in Michigan, Higgins Lake, is a type E, so it's just one of the regulation types for the lake. And instead of just having, that categorical information, we also have in a table below, fishing possession seasons, tackle, size limits for various species. And this is, the detailed information that an angler would need in order to fish that water and follow the regulations. Next slide, please. So this is just a quick kind of video of, a live demonstration of the application itself. Hopefully it's running. You can potentially might need to hit. Oh, I see the mouse moving. Never mind, it's going. So you can go back. It should autoplay. I'm not seeing it
Sorry,
go. But
Austin, I don't believe this is autoplaying. Sorry.
Oh, that's okay. I can, just from that screenshot, I can quickly mention that in the application itself, we do have a couple tools. There's a legend of the information as well as some descriptions of the, kind of definitions for the various regulation kind of words. So, those types and gear restrictions. We have kind of a dictionary for that, as well as some images for fish identification. So if you're in the field and want to make sure you have the right, species, you can get that information. Next slide, please. So all this information, the GIS database, is available on our open data portal. So there's 3 different layers, one for streams, one for our brook trout restoration areas, and then one for our lakes. And so all that information is free and available, and you can use those for your own applications or use ours if you so choose. Next slide, please. This application is also mobile friendly, which is really a key point when we were developing this. As an angler in the field, you're really going to want kind of the most, stream side application for those regulations. So imagine, you're on the Osable River going fishing, and then you want to double check what the regulation is at that time of year. So you'll open up your phone, be able to click on kind of the river right next to you, and it'll pull up the information. You're right there, stream side. Next slide, please. So ultimately, our goal with this application was by providing spatially explicit, temporally sensitive regulations in an accessible format, that it will increase the effectiveness of these regulations in protecting and managing Michigan's fisheries. Next slide, please. With that, I want to kind of thank some folks in our division that helped with this application, as well as share a QR code for the application itself. It is also available on the state of Michigan website under our fishing regulations. So if you do want to check out and kind of play with it and get an idea of the regulations in your area, if you're in Michigan, of course, then that's free for you to use. Thank you.
Okay. Thank you, Austin, for that. We're going to move into the Q&A, and we actually do have some questions. The first one is for Sasha. It has to do with the crime in Washington, D.C., if you all recall. We're going to pin all four of the folks, I believe, for this part. And the question is, how did you account for normal annual fluctuations in crime, such as seasonality?
Yeah. So first off, thank you for the great question. I was thinking about it a lot. Um, Things in my way. I think during the project, I didn't really consider it, but I think it is a good thing to consider and is definitely room for future research. Um, Kind of with the small time scale of, granted, it's 200 days. Um, it's still it's tough to tell what the effects are at first glance. I was kind of looking again at the presentation and saw that like August 11th is when the National Guard was mobilized. There is a decrease there compared to first 10 days of August. However, I think as National Guard is still present in Washington, D.C., it's definitely worth to continue and maybe look at if anything has changed a year after the mobilization. So yeah, thank you.
All right. We have a question for Gabrielle. Uh, well, it's a comment. I really appreciate the way your presentation connects historical maps with the present, which I agree. That was great. And one other question for Austin. Okay, get this screen out of my way. There we go. I don't know if this is a fair question to ask or not, but I was wondering if, as the world changes, as the environment changes and the fish situation changes, is that data set like saved off like once a year to create like a historical archive of what happened in the past?
Yes, that is kind of a nice benefit of having this new database is we do archive all the information, as well as those, changes to the regulations we do track it just as a legal standpoint. So there is a history of how they've changed over the landscape, and then we also have our biologist in the field. So if a dam breaks and a pond disappears, we can kind of track that information as well.
Okay, thank you. I
Thanks.
figured it's probably standard. The state of Michigan, probably in general, across all agencies, has the same practices, but I don't actually know if that's true. Okay, that is it for open questions. Thank you, presenters, for sharing your work with us. We really appreciate it. And thank you, attendees, for joining us. We now have a short break before the keynote presentation, which will begin at the top of the hour. You won't want to miss that, so take advantage of this brief break to top off your beverages and strap in.